Hello doctors, have a beautiful day. Today we are looking at the massive blood transfusion. So we are focusing on the complications. Complications include hypothermia. So what is the mechanism behind this? It is as the blood products is stored mainly between the 1 to 6 degrees Celsius. Next is coagulopathy. So in case of coagulopathy, the empty with the PRBC with the RBC alone, it causes the dilution coagulopathy, and this is versus the consumptive coagulopathy, and this is caused by the massive hemorrhage. Next, it can be prevented by starting an early transfusion, and this is of the FFP and platelets and the PRBC. This is in a ratio of 1:1:1. Next complication is the acidosis as well as the alkalosis. So here in acidosis and alkalosis, there is mild acidosis. This is due to the increased CO2 levels, and this is stored blood. This is by 21 to 35 days. Next, what we see is the metabolic alkalosis. So this is the citrate, it gets metabolized to the carbonate. Next, the metabolic acidosis. So in case of the metabolic acidosis, this is due to the tissue perfusion. Then we are looking at the hyperkalemia as well as the hypokalemia. So in case of the hyper and the hypokalemia, initially the hyperkalemia, as the blood stored, it has the high potassium levels, and this is due to the inactivated the sodium, potassium as well as the ATPase pump. So later what happens is there is the hypokalemia. So in later stages there is hypokalemia. So this is due to the intracellular potassium uptake and the metabolic alkalosis. Then the other complications, it involves the hypocalcemia. So in case of the hypocalcemia, it is stored blood. So stored blood is anticoagulated. So the anticoagulated with the citrate, and this binds to the calcium. Next complication, it involves the hypomagnesemia. So in case of hypomagnesemia, the mechanism is by the infusion of large volumes. This is of the magnesium poor fluids and the binding of magnesium to the citrate. Next complication is the impaired oxygen carrying capacity, and this is of the hemoglobin. So this is due to the mechanism is by decreased in 2,3-DPG. Next complication is the volume is overloaded. So this happens in case of the massive transfusion.